A 3-year-old breastfeeding is completely normal. It's pretty normal to breastfeed a child till 3.5 years of age. But if this child is using this breastfeeding as an association to go to sleep, then this is something that the parents need to be cautious about, because most of the times if this happens on a regular basis, what happens is it becomes a cycle, and then the child becomes completely dependent on this breastfeeding to go to sleep. Now most healthy babies beyond 2 years of age, they don't need to be fed at night. A child waking up in the middle of night to breastfeed is less likely because of hunger, and it's more likely because the child wants to go back to sleep and now needs breastfeeding to do that. So this is what we call as sleep association, or the child starting to associate some things as triggers for sleep. So there can be some other examples also for this. So some children want to be rocked to sleep, some children want them to be carried by their parents and then walk some distance so they can sleep. So all these are associations which are not very healthy, and this will ultimately affect the parents. So it's always better to break these patterns and try and build on some healthy associations. So for examples for that would be something like a comfortable blanket, or maybe a soft toy, or a dark room. So if the child now starts associating sleep with these objects or these situations, then it's much better for the child to go to sleep independently without needing to depend on a caregiver.